Well, Governor, thank you so much for taking the time to spend with us this afternoon with WESTMARC and the West Valley Leadership Group. As you mentioned, this is kind of a far cry from what we did last year when we packed the house in Avondale at the Phoenix Raceway. So hopefully we'll get back to those times soon. But
I prefer last year. That was more fun. It was great. What a big room we had. Enthusiastic people, and the West Valley always shows up. So let's make a date for next year, same time.
Heck yeah, let's do it. Awesome. So first I want to thank the virtual audience for joining us today. Appreciate your time and commitment to WESTMARC. And you all responded pretty quickly when we sent out a call for questions. So I want to let you know that truthfully we got a plethora of questions, and I don't know that we'll get them to all of them today, but we'll do our best. So here we go. Kicking it off, man, aren't we glad that we finally have a vaccine?
It's finally the solution in which we can put this behind us. So Arizona's going to do this fast. We're going to do it better than other states, and we've got a real sense of urgency and purpose on this. And right in the West Valley at State Farm Stadium, home of the Arizona Cardinals, we've got a 24/7 vaccination site. They're doing about 6,000 vaccines a day right now. We want to ramp that up to 12,000. So yes, we can get this behind us. We want Arizonans to be safe. We still have to stay very vigilant around this pandemic for right now. We can't let our guard down, but the solution's in front of us. We're working with our federal partners and healthcare officials and experts right here in the state and across the country to do this as effectively as possible for the people of Arizona.
So this might be kind of a tough follow-up, but I think it's great that we hit the healthcare professionals, the first responders, the senior population first. But what about me? When do I get my shot in the arm? Is there a timeline about that, or what are your thoughts there? What does your crystal ball say?
Well, we want to get you a shot. Now, young and healthy has been, of course, a priority after our most vulnerable. So we do think we're in a position now where we're going to be able to be expanding the universe. This started out with healthcare providers, doctors, nurses, hospital staff, emergency medical responders. Then it went to the folks that are in congregate care, long-term care facilities, skilled nursing facilities, retirement homes. Those are the people that were most vulnerable. Then we are moving to cops and firefighters and teachers, because we want our teachers protected. We want to get them back into the classroom. And then we're going to really be able to expand that universe. So look for some announcements here, Sintra, in the coming days on how we expand that. And for what it's worth, because those people are all more important and also more vulnerable. I've not received the vaccine. I said I'm simply not going to get it before my grandmother. She turned 97 on January 4th, and on complete coincidence, she received the vaccine that day. Next comes my mom, and then after that, we'll get in line.
Yeah, there you go. My parents are getting theirs on Monday.
Oh, good.
I'm excited about that. And
are they getting it at the stadium?
They're getting it actually in New York.
Oh, okay.
So, but they'll be back. They'll be back to Arizona soon.